Welcome to the Super Healthy Human Podcast with your host, Dr. Roger Murphy.
Hi, welcome. This is Dr. Roger Murphy, your host of the Super Healthy Human Podcast. My guest today is Dr. Brian Mowll, who is the founder and medical director of Sweet Life Diabetes Health Centers and serves clients worldwide as the diabetes coach. He is a certified diabetes care and education specialist, a master licensed diabetes educator, and was one of the first doctors to be certified to practice functional medicine by the prestigious Institute for Functional Medicine. Dr. Mowll helps patients with all forms of diabetes properly manage their complex health conditions. Additionally, with type 2 diabetes, pre-diabetes, and metabolic syndrome, his goal is not just to manage, but to help reverse these conditions using a natural, personalized lifestyle approach. Dr. Mowll has spent over 20 years focusing on clinical nutrition, physical activity, lifestyle management, functional medicine, and diabetes self-management education, and is widely recognized as a global leader and expert in the field. He is the host of the annual Diabetes Summit, the #1 rated Mastering Blood Sugar podcast. It was named one of the top 50 functional medicine doctors in the world. Dr. Mowll works with clients throughout the world with his critically acclaimed programs, including Mastering Blood Sugar Premier Coaching Program and Mastering Blood Sugar Retreats and 8-week Blood Sugar Boot Camp. Well, Dr. Mowll, I'm so excited to have you here, Brian. I think that this information that you're going to be sharing with us today on the podcast is so needed. Diabetes has exploded around the world. It's not just in the United States. It's everywhere. Patients I talk to around the world, they're telling me that, their doctors telling them that they have type 2 diabetes. And, you can't really, anywhere you go, you see that we've got a big problem with diabetes. And so the first question is, tell us a little bit more about you and how did you get interested as a chiropractor? How did you get interested in diabetes?
Yeah, thank you for that, Roger. I appreciate the intro, and it is a huge problem. You're right, and just to orient folks, because probably a lot of people listening to this maybe don't have diabetes per se, because it's still somewhere around 10 to 15% of the population has diagnosed diabetes, but closer to 89% of the population of the US at least has some sort of metabolic impairment. So that could be overweight or obesity, type 2 diabetes, type 1 diabetes, metabolic syndrome, high cholesterol, triglycerides, PCOS in women. These all sort of fit under this metabolic dysfunction umbrella, and it's almost 90% of the population, so it's huge. As far as my introduction, I got introduced, well, of course, we studied it a little bit in school, but, I didn't know all that much about it other than just some diagnostic criteria and so forth, and basically, just send those back to their doctor. But I found out years later that almost all diabetic patients are horribly mismanaged. A large percentage of them are. And so people were coming to me as I got more into functional medicine and, working with people with thyroid problems and gut issues and food allergies and working with people nutritionally. A lot of people were coming to me and their blood sugar was high and they didn't know what to do about it. Many of them were diabetic, and I started looking up their medications and saying, well, I don't really understand how they're being treated here. And so I really got interested in it and passionate about it from a patient of mine who actually reversed her diabetes. Actually, she wasn't even a patient. She was somebody I met at a class that I did, a workshop. And the first time I met her, she had asked me what I knew about diabetes. I gave her, the little information I had at the time. She came back a couple months later to another workshop that I delivered. These were live in-person workshops at a local health food store. And she had actually reversed her diabetes at that point. 60 days later, had lost 30 pounds, was off of the medication she'd been put on, total transformation. And I was just like, wow, this is amazing.
Mhm.
And, that light bulb went off in my head, like, I want to be able to help people like her more.
Mhm.
And so initially I put together a workshop on diabetes, so I did all this research to, put these slides together, and I was going to have her come speak and all that. And the more I studied it, it just like lit a fire in my heart. I just got really passionate about it. And so then I ended up going back, believe it or not, working in an endocrinology office as a diabetes educator, sort of part-time, just so I could kind of see the other side of it and get a good understanding of the, medications that are used and how people are actually treated. And, I knew it was going to be bad going in, but it was way worse than I expected. And so I came out of that with even more motivation. And just at that point, that was maybe 15 years ago, sort of totally committed and dedicated my practice to caring for people with diabetes.
And it's interesting you mentioned these figures here just a moment ago about so many people with metabolic disorders, and I read this this figure the other day that said 89% of Americans have an insulin resistance problem. So
right,
it's just whether you call it type 2 diabetes or pre-diabetes or whatever you call it, obviously we have a problem, and I think and I'm sure you were really when you were working in the endocrinologist's office, I'm sure it was so frustrating to see the way it used to be treated. It's changing now, thank goodness. And I think a large part of that has to do with people like yourself that practice functional medicine. But I remember one of the first books that really got me interested in functional medicine, and it was a book by Diana Schwartzbein out in California, and it was called The Schwartzbein Principle. And she was working with type 2 diabetes patients who were able to reverse their diabetes by giving up carbohydrates and doing something so shocking as eating protein and fat, which is what you advocate. I know is really, it's not the diet that is out there, the American Diabetic Association diet, which for years was saying, to eat starches and eat whole grains and that thing, and steer clear of fat. It was a totally turn it upside down.
Yeah.
And that really was fascinating to me to see that you could do something, what was being told to the public was really the opposite of what they needed to hear. And I guess that had to be frustrating for you when you were seeing these patients that would come in, month after month and were getting worse instead of getting better, right?
Oh, absolutely. And it's just drugs, insulin, this medication, that medication, polypharmacy. And, oh yeah, send them to the dietitian for a visit or two to get a little nutrition coaching. But even that is, it's like 1970s, 1980s nutrition. Still today, I mean, there are obviously dietitians who teach other things, who have kind of taken the advice, the things that they learned in school and sort of thrown those all in the garbage and sort of put themselves back through a nutrition education and teach something different. But that's probably less than 1% of registered licensed dietitians, at least here in the US. I mean, almost every single one of them. And I always tell people, if they're working for a hospital, if they're billing your insurance, they're going to follow the guidelines. They sort of have to, so you're going to get that old, outdated nutrition advice, which actually kind of contributes more to diabetes. And this is why if you walk up to 10 conventional doctors at a diabetes convention and say, how many people have you seen reverse their type 2 diabetes in the last year? It's probably going to be a goose egg, maybe one or two at best. They don't see it because drugs, medication, conventional diet therapy, it doesn't reverse type 2 diabetes. It doesn't work. It works to maybe keep the blood sugar down to a manageable level. It works to maybe prevent some of the most devastating complications of diabetes, but it certainly doesn't fix the cause of the problem. And so, that's what I know you and I are after in functional medicine. We're always sort of trying to dig down deeper and find really the root cause, what's driving the dysfunction in the first place. And so you're not going to get that in a conventional doctor's office or from a conventional dietitian.
We're still recovering from the old days where it was a low-fat diet that was advocated, 30 years ago, right? It was a low-fat diet. That's still being passed on, like this message that goes around the room and gets, it just never ends, right? So we're paying the price for that. And we're obviously some diets have come along that people, like the keto diet and the paleo diet. So but I think we're still recovering from this idea that fat is bad for you. And, and
especially saturated fat, right? I mean, saturated fat is still demonized.
Yeah. And what's really frustrating is type 2 diabetes anyway. We'll talk a little bit more about type 1, but type 2 diabetes is, to me, it's very reversible. It's something that it's not even that hard to reverse most of the time, right? Wouldn't you agree?
Well, I don't know if it's not hard to reverse. It's certainly not hard to make significant changes.
Yeah.
It probably depends on how far it's progressed. I would say that most cases, something like maybe 60 to 70% of cases of type 2 diabetes are reversible. I think there are some who, maybe there's going to be, some management still involved at the end of the road. But, but I guess if you're willing to continue to work at it, I never take away anyone's hope. I think there's always a possibility of reversal. The thing about type 2 diabetes versus, let's say, type 1 diabetes, or maybe other diseases, is type 2 diabetes is really a dysfunction. It's not a disease per se. It's not a classical disease like an infectious disease, or like type 1 is an autoimmune disease where there's like permanent damage done to the body. And so, we need to treat that medically. With type 2 diabetes, and you talked about 89% of people with insulin resistance. So I call that the metabolic spectrum, metabolic dysfunction spectrum. And so we can put PCOS along there. We can put obesity, not all cases, but most cases of obesity, overweight, type 2 diabetes, prediabetes, metabolic syndrome, even Alzheimer's disease really can fit along that spectrum. And many cases of sleep apnea. I mean, there's all sorts of things that fit into that metabolic dysfunction spectrum.
Yeah.
And to me, it is a dysfunction. So think about the word dysfunction. It's poor function. So what that infers is that if you can improve the function of the body, the dysfunction can go away. And the manifestation of that dysfunction, which in the case of type 2 diabetes, the sort of end result of that is high blood sugar and then all the problems that come with that. But the dysfunction is upstream from that, right? So it has to do with, you mentioned insulin resistance, and then there's a whole group of root causes underneath that insulin resistance. And that's really the key to reversal, is you have to identify the root cause. So you would say, is it easy? Well, I guess it's easy if you follow the right plan, right? So if you really do find the root cause and you fix it, then it is going to be reversible most of the time. And so the changes aren't always easy, but the process, I guess, is pretty simple.
Well, and I think, one of the big challenges is that most people, they would rather just take a medication than they would change their diet. I mean, that's for most people, or they're on the wrong diet. But they feel like if they're taking a medication and it's keeping their A1C level, their blood sugar average within check, or that they're comfortable with that because their physician's comfortable with that. But with type 2 diabetes, as you so well know, I think the statistics are 90% of those with type 2 diabetes are overweight. They're obese. So they're carrying around too much weight that's really brought on this problem. Um, and what I have found is if you can get them to lose weight, and we're going to talk about that, some strategies for that. And you've got a brand new book out. I want to talk to you about the ProFast diet. I'm really excited about that. But that's treating the cause for a lot of people. It's just carrying around too much weight. They're carrying around too much weight, and it's creating these problems, this insulin resistance. And rather than trying to cover it up with a prescription medication to lower the blood sugar, you can actually, by losing weight, you can start to reverse, not everything, because that's the other thing is what people don't realize is the damage is there. Whether you are taking medication or not, the damage continues, right? The damage to the nerves, the damage to the cardiovascular system, that's going on whether you're taking a medication or not, right?
Correct. Yeah. Yeah. I oftentimes liken it to a fever from an infection. So if you've got a raging infection and you've got a fever because of it, your body temperature is high, you can lower the fever with an antipyretic drug, an NSAID or something like that. But if you don't treat the infection, you're still dying, or you're still, losing your health. The infection is still raging. You just don't have the fever, and actually that in the case of a fever can work against you a little bit. But in the case of high blood sugar, it does help often to bring the blood sugar down because, high sugar in and of itself is going to cause a lot of damage to the body. So we do want to get the blood sugar down, but that's where conventional medicine stops. And to back up your point, there's so much more that can be done. That's the tip of the iceberg, right? So the big chunk of ice underneath the surface is the root cause. And that's when I mentioned this metabolic dysfunction, that's really what I'm talking about.
Yeah, I was going to say
just one other thing. Diet is a huge factor, and you mentioned diet. I talk a lot about diet. It is very important. But there are people, and there might be people listening to this right now, who have already cleaned up their diet and they still have high blood sugar. They've already lost weight and they still have high blood sugar, and they're wondering, what's going on here? Those are some of the root causes, and they're some of the most common, most influential root causes. But there are other things. And I know, Roger, you talk a lot about these things, and maybe not always in connection with blood sugar, but toxins, for example. There are toxins known as diabetogens, which can block insulin signaling, leading to insulin resistance and diabetes. There are nutrient insufficiencies like chromium and zinc and magnesium. If you don't have enough of these nutrients, it can affect your blood sugar. Stress can affect your blood sugar. Poor sleep can affect your blood sugar. Mitochondrial dysfunction, thyroid imbalance, which I know you talk a lot about, has a very intimate connection with blood sugar regulation and metabolism. So it's not always just change the diet. That is a huge first step and an important piece. But sometimes, and I think just because of the nature of what I do, practicing in sort of a functional medicine model, a lot of the clients I get have already made the dietary changes. They've already lost some weight. Maybe they need to lose some more, or some of them haven't also, but oftentimes it's those other root cause factors that haven't been addressed yet. And I think, I know you do a great job of addressing those, and that's really central. Like when someone becomes a patient or a client of mine, we do a full workup, and that's really central to reversing the diabetes. Is let's first get a really good understanding of what's driving the problem.
Yeah, so it's like me being a fibromyalgia doctor. People go everywhere, see all these different doctors, and then they wind up on my other end of my phone. Right. Same for you with the diabetes. So people go over, they tried everything, they clean their diet up, and then they realize, hey, I've got to, I need an expert to really help me figure this thing out. What I see in my fibro patients who have type 2 diabetes or have elevated A1C levels that have never been, gotten the diagnosis of type 2 diabetes. Although a lot of my fibro patients have type 2 diabetes,
Mm-hmm.
I find that the majority of them, just by losing weight, again, there's a
Sure.
segment of those that's not going to work. But just to give you, those of you who have type 2 diabetes, just to give you some hope, there are some things that you can do that can make dramatic, changes, positive changes. And one of those I find is by losing that excess weight with the right diet. And it's got to be something that you can do, and it works, like the diet we're going to talk about your diet, which I'm excited about. You can see just incredible changes to your blood sugar. A1C levels can be normalized in, a couple of months. And, so there is hope. There is hope. You don't have to live with diabetes. You can be proactive, and you can get with someone like Brian, who can help you really navigate it and not have to be on medication, really just treating the symptoms the rest of your life. Before we go further, I should have just kind of
Sure.
started with this, but what can you, just for the audience, can you tell us what's the difference really, quickly and simply, between type 1 and type 2? Let's talk a little bit about that. And then on the back end of that, why is type 2, we're going to focus on that, type 2 diabetes, why is it such or should be such a concern for those who have it?
Mm-hmm. Yeah, really good question. So type 1 is an autoimmune disease. And so there's Hashimoto's thyroiditis, there's lupus, rheumatoid arthritis. There's lots of different autoimmune diseases, and they all sort of manifest in different ways, but it's self-attack. So the body's immune system is destroying some sort of tissue, some sort of, body tissue. And in the case of type 1 diabetes, it's the part of the pancreas that makes insulin. So people who are diagnosed with type 1, usually it's early in life. It progresses very rapidly. So, usually the child goes from having no problems to withering away to nothing but skin and bones, with very high blood sugar. They're thirsty, they're urinating constantly. And when they check their blood sugar at the doctor's office, it's usually like 300, 400, 500, very high. And if it's not treated right away, it can be fatal. So the treatment is to give them insulin because they're not making insulin. So what happened on the inside is their immune system, for whatever reason, got the signal to attack these cells in the pancreas, which make insulin. It destroyed them. They're no longer making insulin. Without insulin, we don't store energy. And that's something that's important to remember as we transition here to type 2. Insulin is an energy storage hormone. That's its main job. Well, it has two main jobs: store energy and stop the body from breaking down stored energy. So one is anabolic, store energy. The other is anti-catabolic, stop the body from breaking down stored energy. So if you don't have insulin, your body breaks down all your stored energy. You lose all your fat, you lose all your muscle, you wither away to nothing but skin and bones. If you have too much insulin, which is actually the case in most cases of obesity and overweight and type 2 diabetes and prediabetes, there's actually too much insulin. When you have too much insulin, you store all that energy. And the insulin, remember, stops you from breaking down stored energy. So when you have high insulin, you can't break down your stored body fat. So it makes it really hard to lose weight when you have high insulin levels. A lot of people say, I just look at food and I gain weight. I don't know why I can't lose weight. I go on a low calorie diet, I still can't lose weight. Usually it's because they're insulin resistant, which then the body compensates for that by overproducing insulin. I've checked insulin levels on thousands of people. There's a belief in conventional medicine that when you have type 2 diabetes, you don't make enough insulin. Not true at all. 95% of my type 2 diabetic patients over the years have elevated insulin levels. They're making too much insulin. They're just so insulin resistant that insulin's not able to do its job properly. So what happens then is the blood sugar rises. And that's what type 2 diabetes is. So type 1 is not enough insulin due to autoimmune disease. Type 2 diabetes typically is insulin resistance. So the body doesn't respond to the effects of insulin as well. So we don't take that glucose out of the blood and put it into storage like we're supposed to. So that's what happens if the blood sugar goes up. And usually there's weight gain either before or after diabetes. That's the other thing that I think there's a lot of misunderstanding about. Having insulin resistance causes us to get fat, causes us to gain fat, gain weight. And being fat causes us to be more insulin resistant. So it's one of these vicious cycles. Yeah, and eventually that progresses to diabetes when you lose the ability to control your blood sugar. So there's about a teaspoon of glucose floating around in your bloodstream at all times. And when you eat, if you were to drink a Coke, hopefully you don't do that, but maybe you're drinking like 10 or 11 teaspoons of sugar. You only have room for one in your blood. So the rest of that sugar's got to go somewhere. And, the body tries like heck to get rid of it. You do that over and over again, though, and the system gets tired, and eventually a lot of it starts hanging around in your bloodstream, and your blood sugar goes up.
So I've heard it explained in very, similar. It's great how you explain that. But I thought this really resonates with people is that insulin is kind of like a key that opens up the door that allows the sugar, the glucose, the fuel to get in the cell where it's stored if it's not used right away. And obviously, would you say 1 tablespoon, 1 teaspoon?
One teaspoon. Yeah, about 4 grams, about 4 grams of glucose
so
in
if
your
you're
blood.
sitting down and eating, it doesn't have to be sugar. I mean, it could be a simple carbohydrate with starch that breaks down really quick into sugar, like a banana or a bagel or pasta or whatever it is that, your body has to take that sugar, that glucose, that fuel, and either use it or it stores it. And what happens over a period of time, if you're not using it and you're storing more than you're using, it's kind of like our closets. I know in my house, unfortunately, they get filled up, filled up with stuff. And then you go to try to open it and you can't even open it. So now what's happening is this fuel, this sugar that should be deposited into your closet or into your cell is just left out in the bloodstream. And that's what creates the problem. So if you have type 2 diabetes, why should you be concerned? And you should be, right?
Yeah, good. Yeah, really important thing to think about. So diabetes is one of these conditions, kind of like heart disease or high blood pressure, where if your blood sugar is elevated but not sky high, you may not even know it, right? So there may not be any symptoms of the high blood sugar until it gets really high, but it's doing a lot of damage to the cells. So both high blood sugar and high insulin cause tremendous amount of stress to our body. The high blood sugar will cause something called glycation. It's a form of oxidative stress. I describe it a little bit like caramelizing our cells. So if you've ever seen a chef make a creme brulee where they put the sugar and then they burn it with a little blowtorch and it gets brown and crusty and crispy, that's kind of like what happens when your blood sugar is high to your brain cells and your kidney cells and the cells that line your blood vessels. They get crispy and crunchy and glycated and sugar coated. And so then that leads to inflammation, which leads to disease. So with type 2 diabetes, with type 1 diabetes, if there's high blood sugar, we see cardiovascular disease like heart attacks and strokes 3 times as much. We see actually diabetes is the leading cause of adult blindness. It's the leading cause of adult foot or lower limb amputation. It's the leading cause of adult kidney failure. So kidneys, limbs, poor wound healing, sexual dysfunction, Alzheimer's disease and dementia are linked to high blood sugar and diabetes. In fact, there are some researchers who call Alzheimer's disease type 3 diabetes because of the mechanism there. And cardiovascular disease. Actually, I think it's 6 of the top 10 leading causes of death are either diabetes or related to diabetes. So it's a major issue. And again, it can progress silently. That's one of the worst things. The other thing that really drives me crazy is people will go to their doctor, find out they have high blood sugar, and the doctor will say, well, your blood sugar is a little high. Let's keep an eye on it. At that point, they've already lost control of their blood sugar. They're already in a disease or dysfunctional state. They're already building damaged tissue. And basically what the doctors are doing is waiting until it crosses a diagnostic threshold. The number gets high enough to where they can then treat it with medication, instead of actually trying to find and fix the root cause. So there's millions and millions and millions of people walking around, hundreds of millions of people in the US alone, walking around thinking that their blood sugar is a little high. And, they better watch this. Their doctor's going to put them on medication if if it gets worse, type of thing. When really, they should be doing something about it now. They should have done something about it years ago, but they should really be doing something about it now once they find out.
So Jeffrey Bland, one of my mentors, and I'm sure you know Jeffrey Bland, father of functional medicine, he describes these people as the walking wounded. They're supposedly healthy, right? You fall within the parameters and you're supposedly healthy, but really with type 2 diabetes, you're really a ticking time bomb, because the damage, as you so well pointed out, it's occurring, whether it's arteriosclerosis or damage to the kidneys or damage to the retina, to the eyes, or to the nerves. It's happening, and it's happening even if you feel like you're taking your metformin every day. It still can be occurring, even though you feel like the numbers look good, so everything's fine. But as you so well pointed out, you look at all the potential ramifications of once you get the diagnosis and the damage is being done. What'd you say? You double the risk of
triples the risk of heart disease, cardiovascular disease, so heart attack, stroke.
And then I think the presentation I gave not too long ago on a PowerPoint, I think I remember it reduces your longevity lifespan by seven or 8 years or something.
That's right.
It's something that you really want to be proactive with, right? And not just rely on taking prescription medications. You really should be adamant about fixing the underlying cause and not just covering up with the medication, right?
Yeah, absolutely. And as you said, one of the best things you can do, in addition to changing your diet to a more healthy, whole food, I prefer lower carb, at least lower processed and refined carb diet, is change your body composition. So you said lose weight, and I'm being a little nitpicky here, but I like the idea of losing fat or burning fat a little bit better, and particularly changing body composition. So we talk about trading fat mass for lean mass, building more lean body mass, burning your fat mass. As you do that, as you move more towards, picture like a bodybuilder, with massive muscles and hardly any fat. And then picture, somebody who's 400 pounds and very obese. So those are the two extremes. And you want to move more and more toward, you don't have to become a bodybuilder, but you want to move more towards that picture of that bodybuilder, more muscle, less fat on your frame. You're going to be more metabolically healthy, more metabolically flexible, because the more muscle we have, the more glucose disposal we have. Muscle is the largest organ of glucose disposal in the body. So the brain uses more per weight, but we have a lot more muscle than we do brain. So muscle is the largest disposer of glucose in the body. The more muscle you have, the more mitochondria you have, the more insulin receptors you have, the more glucose you're going to use. So and you have more room to store glucose as glycogen also in the muscle. So if we want to try to build that and cut down on fat, because fat mass, particularly, you can have a little bit of fat, under the skin. That's totally fine. But once the fat starts spilling over into our organs, like our liver and our, deep abdomen, into our muscles, sometimes our muscles will become fatty if we build up too much fat. That's where disease starts to happen. That's where that fat becomes pathogenic, or what I call angry fat. It becomes inflammatory fat. Mm-hmm. And it actually releases inflammatory signals like TNF alpha and interleukin 1 beta and interleukin 6, these chemicals which drive the inflammation process and cause insulin resistance. And that's where diabetes, type 2 diabetes, actually starts. So if you can, as a pre-diabetic or as someone who's just maybe got an extra 20 or 30 pounds on your frame, and especially if it's in your midsection, this is very true, as I think you probably know, for postmenopausal women, they start to store a lot of fat around the midsection. And if you can get rid of, 10 or 20 pounds of that extra fat around your middle, it'll make a huge change, as you said, in your blood sugar and your metabolic health.
And not only that, you'll see that as you lose that weight, you also are losing inflammatory chemicals, because that's right, for those inflammatory chemicals in those fat cells. So I see that over and over again. My patients who are carrying around this extra weight and they go on a particular diet that I use, and as they're losing that weight, not only does their metabolic markers start to normalize, their A1C, they see their inflammatory markers go down and become normal, but they have less pain, they have more energy. As you mentioned earlier, they sleep better. All that starts to improve. And it's ironic that the other approach is we're going to medicate you, knowing that it's probably continue to get worse and worse. So as you start to develop other issues, cardiovascular issues usually, we're going to add another medication to deal with that. And then if the medication that we've got you on to control the blood sugar is not working, we're just going to give you some insulin. Since you can't, and as you pointed out, insulin actually causes you to gain weight. So now you're taking this insulin, it's causing you to gain more weight, which is causing your blood sugar to go up. It's a terrible model, isn't it? I mean, it's just a terrible model that most people in the conventional medical world and the people, and lay public have kind of bought into that.
They bought into it. They don't even think about it. Right. But yeah, it doesn't make any sense. It really doesn't. It's totally backwards.
Yeah. Well, let's talk about your diet. So you've got some answers. I like the diet. I think that the diet it's got some similarities to things that I talk about to my patients.
Absolutely.
I think it could be a real game changer for people. So tell me a little bit about your diet. I want people to hear a little bit about it, and I want them to get excited that, hey, this is a book. Yeah. Your book. I think everyone needs to check this diet out.
Yeah, I appreciate that. Thank you. And it probably similarities because it works, right? So, it's so the idea is, conventionally, there's still dietitians still talk about calorie counting and trying to cut your calories by whatever, 500, 600, 700 calories a day to try to lose a pound a week, pound and a half a week. And we just know that does not work. It fails miserably. When you make small changes like that, you cut your calories by 500, or you try to exercise off 500 extra calories a day, it just fails. Maybe it works for a little while, but ultimately you hit a plateau and then you crash. So what happens there? You have to ask the question, what's actually going on? So if you just reduce your caloric intake, the amount of food that you eat across the board by, say, 500 calories, what's going to happen is your body's going to adjust to that. Your metabolism's going to slow down. You're going to just burn less calories, and eventually you're just going to get back into equilibrium now on less food. If you exercise more, same thing. Your body will your body will adjust to that. So it becomes more efficient. You're actually burning less calories when you're exercising. And usually you just eat more. You just don't realize you're eating more. You're a little bit hungrier. You eat a little bit extra food to bring your calories up. And so again, it levels off. You don't lose any weight. And that's what's still recommended. It's the CICO model, calories in, calories out model. So the idea of energy balance, which is, calories in, calories out, is true. It's not that it's wrong. It's just that the application doesn't work. What I think you do, and what we've found works the best, is making more drastic changes, dropping the calories, or what I call energy, which is the carb and fat calories, drop those down enough to where the body is not going to be able to bring the metabolic rate down that low. So your body can drop the metabolic rate by maybe 40% over time. So if you drop your energy consumption by more than that, you are going to lose weight no matter what. Now, here's what the ProFast diet is all about. That's the name of the book. It's about not just losing weight, but losing fat and maintaining lean body mass. So there was two scientists back in the 1970s, one out of MIT, one out of Harvard, who got together and did a tremendous amount of research on something called protein-sparing diets. And they wanted to make sure their patients were not losing lean body mass. So they did all these studies with nitrogen balance and played around with different levels of protein. And they found that a certain amount of protein in the diet per kilogram of weight was enough to protect that person's lean body mass. If the person got in that amount of protein each day, which is about 1.5 grams per kilogram. That changes based on activity level and male, female a little bit, but about 1.5 grams per kilogram of optimal or ideal body weight will protect your lean body mass. So what we do with ProFast diet is we make sure we set the protein level first, and the person doesn't go below that. So that's a minimum. They've got to get at least that much protein in a day. That might be 60 grams, 80 grams, 90 grams, 120 grams, depending on the size of the person and their activity level. We set that protein amount in first, and then we'll dramatically drop their energy consumption. So if you look at calorie counts, according to something called the Atwater formula, protein will give you about 4 calories per gram. And that calorie is a unit of energy. So about 4 kilocalories really per gram. Carbohydrates, the same, about 4 calories per gram, and fat is about 9 calories per gram. So fat is more, it actually gives us more energy per gram than carbs and protein does. But the protein is a little bit deceptive because we don't actually use 100% of the protein we eat for energy. In fact, according to the Merck manual of medicine, we use almost none of the protein we eat for energy in the presence of carbs and fat. So what do we use it for? Well, protein is amino acids. So about 25% of it gets wasted in something called the thermic effect of food. So just gets wasted in the metabolic process. So now we're down to about 75% of that. And then the rest of those amino acids get used to make hormones and neurotransmitters and other chemicals in the body. They get used in detoxification pathways. They get used for muscle synthesis, right? So protein, it's deceptive because we're really not getting 4 calories per gram of protein. It's more like 1 to 2 at most. So we don't look at protein and carbs and fat the same way. We look at protein as more of a nutrient, and we look at carbs and fat together as energy. And so those foods primarily, I mean, fats provide, backbone for hormone production as well, and some other things. But for the most part, our fats are going to get burned as energy. Carbs, 100%. 100% of our carbohydrate consumption gets burned as energy. So we want to lock in our protein, and then we want to reduce our energy consumption from fat and carbohydrates. Why do we want to reduce our energy consumption? Because we want to burn our stored energy, right? And I know you talk a lot about this, Roger, because if you've got extra fat on your body and you're trying to lose that fat, you've got to force the body to burn that fat. Right. So we've got to get our insulin levels low, and we've got to get our energy intake low enough that our bodies are going to be forced to burn our stored fat. So if you're eating let's say a 500, 600, 700, 800 calorie diet with your protein levels adequate, so you don't lose any lean body mass, you're not actually living on 500 to 800 calories a day, right? You're still living on whatever you need, 2,000 calories, 1,800 calories, 2,500 calories. You're still going to burn that same amount of energy. It's just you're burning your stored body fat instead of getting it from your food, right? So that's really what the ProFast diet is about. Now, this isn't meant to be a lifetime eating plan. This isn't something you're going to do for the rest of your life. We use this plan as a therapeutic eating strategy for people who want to lose weight, burn fat, and lower their blood sugar. Because as they burn that deep visceral fat, they become less insulin resistant, and their blood sugar will improve. And oftentimes their diabetes will reverse. People are coming off of medications, coming off of insulin, dropping down metformin and other diabetes medications as they're burning that deep visceral fat while they're maintaining their lean body mass. So it's a 6 to 8 week program. Sometimes people have to go through multiple cycles, but we don't do it all at once. We try to do it in cycles so that they will maintain those changes that they've made and prevent sort of a backslide. But if they do that, we've had tremendous success with people dropping massive amounts of weight. I know you have too, but we've had, dozens of patients and clients lose over 100 pounds using this diet, this program over, many, many, many months, because it works, just like what you do works, because it's forcing the body to burn its stored body fat.
Now, in the ProFast diet, are they going into ketosis?
Absolutely. Yeah. It is. I tell people it is a ketogenic diet. It's not a high fat ketogenic diet, but they do go into ketosis. It's funny. There's a lot of misconceptions about the ketogenic diet. The ultimate ketogenic diet is pure fasting. If you do pure water fasting, you're going to get up to 4 or 5, sometimes 6 millimoles per liter of blood, beta hydroxybutyrate in the bloodstream. Hardly any diet will put you that high in nutritional ketosis. So because it is an energy restricted program, after about 3 to 4 days, your blood ketone levels are definitely going to increase. We don't see, 4, 5, 6, but, we'll see people at 0.5, 1, sometimes 2, up to 3 millimoles per liter.
So in ketosis, for the audience that doesn't know, when you go into ketosis, your body's now burning that visceral fat, that yellow fat, unhealthy fat, and it's using that fat as a source of fuel rather than using the sugar or the carbohydrates that you would drive the sugar. So it's a way to get the fuel, and it's from this excess stored fuel that you have in your fat cells. And but now the ProFast diet it has some similarities to the keto diet, but it's also a lot of differences as well too, right?
Right.
Yeah.
Right. And I'm glad you mentioned that, because people often ask, well, what do I do after this? Let's say I lose 20 pounds and I'm leaner and fitter and my blood sugar's under control, then what I do? Well, we do shift people to more of a higher fat, doesn't have to be ketogenic, but certainly low carb, adequate protein, higher fat type of diet. And that's a great long-term maintenance strategy. The difference basically between a ketogenic diet and the pro-fast diet, like a standard ketogenic diet, is pro-fast is higher in protein and much lower in fat. We don't eliminate fat, but it's much lower in fat. So you're mainly getting your fats from your protein sources. There's not really a lot of added fats on pro-fast diet.
What's your take on the carnivore diet?
Well, I think it can be effective as well. I think that most people will benefit from some fiber. And I do think that vegetables are one of the most nutrient dense foods on the planet. So if you're eating the right vegetables, I think vegetables can be a healthy contribution to the diet. So on pro-fast, it is protein centric, but we also include a lot of fibrous vegetables. But there are people who don't react well to vegetables. There are lectins and other anti-nutrients in many vegetables that will irritate people's gut, will drive their immune system into sort of a panic and can cause problems. And so for those people, using the carnivore diet therapeutically, I think, for a period of time, or maybe even long-term, can be very effective. I don't think most people need to do that, but for people who are in that situation, it can be a lifesaver. Absolutely.
Yeah. Well, I find it hard to believe that vegetables are dangerous for you.
Right.
I know the whole thing about lectins, and for some people that really is a concern, but there's some doctors out there, some authors out there who talk about that vegetables have this built-in defense system, and then that we're eating them, we're actually taking in toxins. And I don't know, I'm not quite there yet. I really keep an open mind.
Most of those are destroyed in cooking and food preparation. I wouldn't recommend eating a ton of raw kale, maybe, but if you cook the kale, it's fine. Spinach, it has some oxalates, but most people can tolerate these things without any problem. And they're providing so much nutrition, fiber, and very little energy. So really, they're an ideal food if you're trying to cut fat and build mass. So gorillas will eat during the dry season. They'll eat actually a very high protein diet. They eat about 30 to 40% of their calories from protein, and they get that all from leaves. Yeah. So it's surprising, but you can actually eat a all leaf high protein diet if you eat enough. Now they're constantly eating, and they eat I think 30 pounds of leaves per day. So most of us aren't going to do that, but still the point is that vegetables are so nutrient dense. And look at a gorilla. They're ripped and lean, so they're certainly not nutrient deficient. So yeah, I think vegetables are for almost everybody are really important to include in the diet. So we don't want to cut those out, especially long term.
So the Pro-Fast diet is available on Amazon, and this is a book that's not just beneficial to individuals with type 2 diabetes. As you heard us mention earlier, we've got 89% of the population has some type of metabolic dysfunction going on. So the diet is for those individuals who want to start to right their dysfunctional metabolic system, or they are to lose weight. So that's part of it too for the individuals who
I do want to be clear. It's not for people who are lean. It's not for people with type 1 diabetes. It's not for people with LADA, which is an autoimmune diabetes that shows up in adults who are underweight or are already have great body composition. This is based on changing body composition of building muscle or maintaining muscle and burning fat. So if that's you, even if it's 15 pounds of extra belly fat, it can be very effective. So yeah, this is the book. You can find it on Amazon.
And I like the fact that the results are quick.
Absolutely.
See that people struggle and they struggle and then they lose their patience and they give up. And the thing that I like about Brian, your protocols, is that it works really quick, and that motivates people to stick with the diet. And then this, they can see it, and then they start to feel how much better, their energy is, how much less pain they have. They look better, that's great, but they feel so much better.
This is something you and I have both been at this for quite a while, and it's something you learn over time, is that you really do need to get quick results with people, because there's a window of motivation. And once that window closes, it's much harder for people to stick with something, at least something, especially something therapeutic. There are people who have sort of that long motivational window and can do it for years, but most of us, it's like 2 to 3 months, maybe 4 months. And then you're kind of like, all right, I'm kind of tired of this. So something that is going to help you to lose a half a pound a week, or like make very slow changes, you're only going to get so far with it. You're going to get tired of it. And then oftentimes, if you try to do it too long, that's where you crash and burn. So yeah, I like the idea of getting in, getting out, 6 to 8 weeks, you're done, at least for a while. You take a little break. If you want to go back into it down the road when you feel, mentally refreshed and ready to do it, great. But yeah, fast changes are motivating. You look down at the scale, you see that weight falling off quickly, and it just keeps you going.
Brian, this has been great. And again, the book is The Pro-Fast Diet. It's available on Amazon. I want to encourage everyone to get a copy of the book, and I'll be curious to see what the feedback is. I enjoy it. So I think the book makes a lot of sense. I think the diet is an incredible game changer for individuals who are looking to lose weight and to normalize their blood sugar, to fix the insulin sensitivity issues. So congratulations. I think it's a book that's going to be very well received, and I think it's going to really benefit a lot of people.
Well, thank you for saying that. I appreciate you having me on and sharing this message. I told you last time I interviewed you, your fibro book was something that I discovered years and years ago. I can't remember when it came out, but I feel like it was 10 years ago. And at the time I was doing a sort of more general functional medicine practice, and basically anybody that I saw with fibro, I was like, just give them Dr. Murphy's book, because it's the Bible on handling fibromyalgia. So I appreciate all the work you're doing, and thanks for having me on.
We'll do it again. So thanks, Brian. Take care.
Okay, thank you.